This is Health 54, the program that lets you in on health-related issues across the 54 African countries and the globe, right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu, and you're watching Health 54. According to the National Primary Healthcare Development Agency, data of May 5, 2021, a total of 1,266,742 eligible Nigerians have been vaccinated with the first dose in the first phase of the COVID-19 vaccination. At least 5 states are yet to reach the 50% target mark of the first dose of COVID-19 vaccine. This brings the proportion of those vaccinated to 63.0%. The states yet to reach the 50% benchmark are Akwa Ibom with 39.6%, Anambra 35.1%, Rivers 48.7%, Sokoto 42.1%, and Taraba 42.7%. Shortly after receiving his first dose of the AstraZeneca COVID-19 vaccine, the Commandant General of the Nigeria Security and Civil Defense Corps, Ahmed Abubakar Audi, hailed the efforts of the Executive Director of the National Primary Healthcare Development Agency, Faiza Shuaibu, in ensuring that the vast majority of Nigerians receive the vaccine. And the World Health Organization reviews more COVID-19 cases have been reported globally in the last 2 weeks than during the first 6 months of the pandemic. The WHO Director General Tedros Ghebreyesus said more than half of last week's COVID-19 cases were reported in India and Brazil. According to him, there are many other countries globally that are facing fragile situation. Indian hospitals, morgues, and crematoriums have been overwhelmed as the country has reported more than 300,000 daily cases for more than 10 days straight. Many families have been left on their own to scramble for medicines and oxygen. Also, the WHO Regional Director of Africa, Matshidiso Moeti, has said many African countries are at high risk of COVID-19 resurgence as a result of poor adherence to public health measures, mass gatherings, low testing, and vaccination rates. Matshidiso Moeti, who disclosed this during a virtual press conference, noted that while 3 countries might face very high risk of COVID-19 resurgence, 20 face high, 22 moderate risk, and only 1 country faces low risk, according to the risk assessment of 46 countries. She explained that the risk was estimated using 7 indicators with data from the past 4 weeks, including COVID-19 cases per million people, the percentage of change in new cases, the percentage of change in new deaths, the reproductive number, the rate at which an infection spreads, the pandemic trend, the average weekly number of tests per 10,000 people, and the percentage of the population that has received at least 1 vaccine dose. India has announced that the double mutant variant of the coronavirus first discovered in March may be linked to a deadly second wave. Samples containing the mutant of B1617 variant have been found in several states with high case numbers. An official with the National Center for Disease Control said they are still unable to fully establish a correlation. India reported a record of 412,000 cases in the space of 24 hours on Wednesday and 3,980 deaths. The government's top scientific advisor also warned a 3rd wave is inevitable. Nigeria have placed a temporary ban on non-Nigerian passengers who travel to India, Brazil, and Turkey in the last 2 weeks because of concerns over the rapid spread of coronavirus in those 3 countries. According to Nigeria's Presidential Steering Committee on COVID-19, the travel ban does not apply to passengers who transited through those countries. Nigerians and permanent residents who were in those countries in the last 14 days will have to undergo mandatory quarantine for a week in a government-approved facility on arrival. This is TRS Television Network and you're watching Health 54. Do stay tuned. Welcome back. This is Health 54 on your favorite channel, TRS Television Network. South Africa recorded a new 2,073 coronavirus. The country's total case now stands at 1.58 million. The country's health minister, Zweli Mkhize, given details in his daily update to the nation, said 46 COVID-19 related deaths have been reported, which brings the total deaths to 54,557. The minister conveyed his condolences on behalf of the government to the loved ones of those who died and thanked healthcare workers who treated the deceased patients. Casey said over 10 million COVID-19 tests have been conducted since the virus was first detected in the country last March. Cumulative recoveries stand at 1.51 million, representing a recovery rate of 95%. Mkhize said earlier Wednesday that the country is on high alert for the COVID-19 variant circulating in India. He said the government shares the concern, but assured the public that they are a very capable nation that knows how to deal with the burden of a new variant. The Democratic Republic of Congo officially declared the end of the 12th epidemic of the Ebola virus on Monday. It comes 3 months after a resurgence in the east of the country in the North Kivu province. He said it is largely thanks to vaccines from the American laboratory Merck and Dome. A total of 12 cases had been recorded with 6 deaths and hundreds of people vaccinated since the resurgence of the epidemic on February 7 in North Kivu, the health minister stated. The COVID-19 variant first diagnosed in India has been detected in Kenya. The health ministry disclosed this on Wednesday, days after the same variant was detected in neighboring Uganda. The health ministry last week said Kenya was suspending flights to and from India. Uganda detected the same variant of India COVID-19, igniting fears the East African nation could suffer a resurgence of cases just when its outbreak has waned. A senior health official disclosed this on Friday. A variant, he said, had been detected in recent days in Uganda. He said a Ugandan had returned from a visit to India. He did not immediately have further information. So far, Uganda, like many African countries, has experienced a relatively mild COVID-19 outbreak, but concerns it could be vulnerable to contagion from the Indian variant are underscored by its large Indian community and strong relationship between the two countries, as India is a major exporter to Uganda. As of Tuesday, Uganda had reported 41,797 infections and 342 deaths, Health Ministry data disclosed. On Thursday, the Africa Center for Disease Control and Prevention warned India's intense outbreak was a reminder that Africa must stay vigilant. The head of the health agency, John Nkegozang, said the African Union will convene a meeting of African health ministers on May 8 to put everyone on alert. India reported more than 379,000 new coronavirus cases and 3,645 new deaths on Thursday alone. It was the highest number of deaths reported in a single day in the world's second most populous country since the start of the pandemic. And amid complaints of false positive tests, Israel calls on its citizens to follow the archipelago's COVID guidelines as the most vaccinated country in the world reimposes restrictions over hiking infection rates. Israel has called on its citizens in the Seychelles to comply with quarantine regulations after dozens of vaccinated tourists complained on social media that they were prevented from leaving the Indian Ocean archipelago. due to what they believe to be false positive COVID-19 test. Southern 7 Health Department has given an insight into what they call a hidden epidemic, and they urge priority populations to get tested and vaccinated. They said the virus infects the liver and affects about 1.4 million Americans. May is Hepatitis Awareness Month, and May 19 is Hepatitis Testing Day. If you are pregnant or plan to become pregnant, then it's best to get yourself tested to make sure that you are not a hepatitis carrier, said Southern 7 Community Outreach Coordinator Shona Raheni. There is no cure for hepatitis, although it can be prevented by a vaccine. The HPV vaccine can prevent a baby from being infected, so the Centers for Disease Control and Prevention recommends all babies get the shot at birth. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. I am Rose Audu, and thank you for watching.